Hello and welcome to ER Mentorship Hub. Today, we're diving into an intriguing case study that underscores the importance of cardiac enzymes in diagnosing chest pain. It's a story that will challenge your diagnostic skills and highlight why ECG analysis alone isn't always enough. Meet our patient, Mrs. Anjali, a 56-year-old Indian lady who has been experiencing central chest pain for the past 18 hours. This pain, which fluctuates between a pressure sensation and a sharp sting, has also been radiating to her back. She feels some relief when lying down but cannot walk a few steps without it getting worse. She is also feeling very hot. She is a known diabetic and hypertensive with long-standing hyperlipidemia. So today we are going to look at the ECG that was done on arrival in the ER. Remember to always be methodical so that you don't miss any steps. Take a few moments to look at the image, pause the video if needed, and see if you can come up with a diagnosis. First, the axis. Anjali's ECG shows a normal left-sided axis with positive deflections in leads 1 and a VF. This does not mean everything is okay, but lets us know that if there is any heart or lung pathology, it is not causing one side of the heart or the other to dominate. It also shows that she should have good hypertensive control, as most hypertensives develop left ventricular hypertrophy and shift their axis to the left. Please note we are not talking about left ventricular strain patterns in this case. Next, the rhythm. The rhythm strip reveals normal P waves and a normal PR interval. But here's where it gets interesting: the PR segment has a distinct downward slope. This is normally associated with a few diseases such as pericarditis and atrial ischemia. The Q or S complexes are narrow and regular, and we may be starting to get a picture of what may be happening. Next, we look at the rate. By either looking at your ECG printout or using your mathematical skills, we find the rate is 106 beats per minute. So, she has a sinus tachycardia. Now let's look at each zone of the heart. First, the inferior zone. In the inferior leads 2, 3, and a VF, we see the heavily sloping PR segment and what initially appears like ST elevations, but this is actually deceptive in this case. When considering the significant slope of the PR segment, we can no longer use it as our isoelectric line. The TP segment becomes our new baseline, and when we use this segment, it reveals that these are ST depressions instead, which are not in keeping with pericarditis or atrial ischemia. Next, let's look at lead of VR. It shows a contrasting upward slope of the PR segment. The septal leads V1 and V2 are unremarkable. On the anterior zone of the heart, we see leads V3 and V4 also display this exaggerated PR downsloping. But again, using the TP segment as baseline, we see that the ST segments are neither elevated nor depressed. When we look at the lateral leads, V5 and V6, and the high lateral leads, VL and lead 1, we get a similar picture to the anterior leads. Initially, Anjali's ECG was misinterpreted as acute pericarditis, a common pitfall given the PR segment downsloping. However, the key lies in the TP segment, revealing ST segment depression in many leads. This observation excludes acute pericarditis. But here's the twist: cardiac biomarkers were markedly positive, leading to an angiogram, which uncovered diffuse coronary occlusions. Anjali was then successfully treated with 2 stents. This case emphasizes why, in chest pain assessment, we cannot solely rely on ECG findings. The absence of clear ST elevations should prompt us to consider other causes, underlining the significance of cardiac enzymes. We hope this walkthrough of an ECG case study and the importance of cardiac enzymes in diagnosing chest pain has been enlightening. Remember, in the ER, knowledge and skill are your greatest tools. If you found this video helpful, please like, share, and subscribe to ER Mentorship Hub for more insights. Stay tuned for our next video, where we'll explore another essential ER procedure. Until then, keep learning and stay safe.